Welcome again, everyone. My name is Ingrid Severson. I am your project manager here at the Pacific Southwest MHTTC for session 5 and our motivational interviewing in July, MI in July, as we like to call it. Session 5 is macro motivational interviewing, integrating individual techniques for socially produced trauma. We want to say that we are so grateful to be funded by SAMHSA. We also want to be clear that the views and opinions expressed by our presenter are theirs and theirs alone. Okay, thank you so much.
So learning objectives for today, we're going to talk a bit about this idea of macro MI, which is kind of a newish concept. There's a new paper that came out around that. I'll show it to you. You can see who the authors are. So the macro MI in the paper I cite, it's not my original work. However, this idea of macro MI or thinking of the idea of how do we use motivational interviewing in the context of kind of larger systemic issues, in addition to like individual care, is a really important concept, right? To think about how to take it to kind of a next level. We'll address this idea of the SHARP model, which is helping us think about like systems change, and the SHARP model kind of helps us figure like what kinds of things are we doing if we're moving from individual treatment, so to speak, to larger systems. Identify motivational interviewing skills that help people that help promote the SHARP model in session. So the MI skills that we're using, how can we use them in such a way that helps kind of promote this systemic work? We will be going through like the ideas, and then I'm going to go back as I have in all the other sections and practice some MI skills. So the skills we have not practiced yet, we're not going to be able to do tons of practice, but we'll talk a little bit about open-ended questions. We'll also do a little bit about summary. And
so how we start here, I'm going to start just showing you this this article. Take a screenshot, write it down. You have the slides, but it's based on David Avrich and Dr. Wendy Chaillet's work, gathering together with Mr. Avrich and Dr. Chaillet, to kind of pulling together their areas of expertise around MI and around the SHARP model, or thinking systemically about problems we have in our systems of care. I am going to not go into huge detail in the article. The article goes into much more detail. Dr. Chaillet has also written other articles on systemic concerns that we should have as practitioners, especially for thinking about equity and providing culturally responsive services. What's challenging is that we're working with people, maybe individually or in groups or in families, and unless we're able to do some kind of broader social work where we might be doing some policy aspects, many of us are kind of working in what we call the micro level, where we're looking at the effects of change on an individual basis, and that involves working closely with people and support them through their challenges. Maybe working with their families, and those folks are really pretty close to them. And again, if you're a social worker, you are familiar with these concepts, but other helping professionals might not be as much. And then we're also looking potentially at what we call the meso level, which involves the development and implementation of social services initiatives at the local and small community levels, schools and neighborhoods. Again, people trained as social workers may specialize in this kind of service provision, right? Thinking a little broader systemically, not just about the individual, but more about some aspect of maybe more local policy, but certainly local programming. And then at the macro level, we're looking at how problems originate, think about large systems, potentially, hopefully, looking at things like root cause, right? Like what kinds of concerns are happening, that start to generate problems throughout entire systems that then hit people at various levels. And we all know this, right? We all know from our work that we have many people that we work with individually who are really struggling with their individual concerns, or their family, maybe in a couples setting, youth, and working with children and their families, maybe their instructors and people close to them. And we're always aware, we're always holding the fact that there's larger factors in play. And I think I can certainly speak for myself. Some of you might also have this experience, and feel free, as we always do, to chat it up in the chat box. There's times when I felt definitely very helpless around, what am I doing here? I'm helping somebody out, and I really feel good about the work that I'm doing one-on-one with someone. And this comes up all the time in MI training. But what happens when I'm bringing somebody back out into a situation that they're going to be in, as soon as they leave my door, as soon as they leave our program, right? And they go back out into a community, they're back out there. And we can certainly think about, we were talking about this a little bit yesterday, the kind of, the strengths and the skills that people have and how that can be very important in coping. Absolutely. And yet, there's also just ways that it's impossible, right? If it's really a systemic piece, then we can't always, again, control individually what's going on systemically, but there's maybe a limit to how our coping, we can change us, but maybe not the system. Right? So in this little piece that we have from the article, they have a really important, I think, statement about the fact that many of us in this field, we're interested, whether it's psychologists, counselors, substance, use treatment providers. We're so interested in reading about all the different aspects of our people's identities and how people who have been minoritized in our larger healthcare culture and our systems and communities in general. For example, people who identify as women, trans folks, racial, sex, or gender minorities, low-income individuals, and that we like to use and like to read about social science data and to really understand how people are affected by systems. And now we're thinking, okay, how do we translate what we're learning about folks and communities into what we're actually doing in our microsystems encounter? Hence, I got my little office in there, right? This little one-on-one office where we're kind of hanging in there and working with folks. But then, if we just read this great article about some of these challenges, what am I actually doing in the room that allows me to address some of this? So we're kind of thinking about, okay, how do we start to move towards the macro? And I put this in here. Some of these are really my framing, and I got to be honest, this is kind of my framing. Am I structurally competent? Doesn't mean I have control over the structure of systems. I don't, none of us have, as individuals, have total control over the systems, right? That's pretty obvious. But on some level, if I choose to speak of the systems or I choose not to, I can end up sometimes being either part of the solution or part of the problem, right? And that can really kind of show up in that particular way. I personally feel, again, this is my opinion, I'm curious what other people are thinking, that if I'm acting as if there are no structural issues, if I'm acting as if there aren't some larger systems, things going on that really impact people, impact their ability to participate in systems, that impact health inequities, that that in fact result in people being minoritized, then I'm part of the problem. Right? If I'm ignoring that for people. And again, this is a shift because for many of us trained in a lot of helping professions, there is this sense of you have your individual work that you do, right? And that's your kind of your part of that's your job, and stay on task and don't get political. And yet, there's a reality of the world that we live in, and more clinicians. And I'm just gonna put out here, well, maybe older folks too, but definitely what I notice, there's been some work around this. Definitely, younger clinicians are really questioning that. So I'm just kind of, seeing what folks say. I know some of this is really provocative, but here are some structurally competent, rationales or approaches, really thinking while I'm working with somebody, again, that idea of acceptance that we have in MI, but I'm not going to judge somebody for this situation they're in. If people are in a particular situation, there's probably real good reasons why they're there. Thinking of all that trauma-informed triangle work, the ways that people have experienced trauma, and including, things like, racism, discriminations of various types, poverty, all being part of that potential trauma. understanding that when we think of a macro framework, that still can be an important place to have some discussion in the room, the clinical room, and that when we help people identify like where they are in a context, if we have them talk about and accept the fact that, yeah, I think I've experienced racism, I've experienced like gender discrimination, whatever it might be, that's really allowing people to identify opportunities for change in addition to feeling like heard and feeling seen. And that it's possible for us to help people feel empowered by facilitating entry into social justice movements. Doesn't mean someone has to take on, full on political action, but maybe there are places, small places that people can enter, and it does, I think, a huge, it's a huge benefit for people to feel empowered in this particular way. Like it's one thing to feel really, at the hands of a system, but then to do even the smallest thing to kind of help address that can be, I think, really rewarding for folks. There's a concept that Dr. Shaya has in this article about socially engineered trauma. And I think that's really important. Do you remember our second day? And I had that table out there. It was really interesting because I remember you all got pretty lit up about that table in a really good way. I don't mean lit up and enraged, but you were really engaged in that, and you were really thinking very deeply about how we think about some of these things, what things weren't there, and how we start to add stuff, or just your experiences with folks you're working with, and really wanting to put voice to what we saw. And she talks about, in this article, they speak about much of the trauma that our folks we experience, people we work with experience, is a result of inequitable and abusive social structures. And socially engineered trauma describes a non-random distribution of trauma exposure within an unequal society. We can all have, certain situations where, climate change, let's say, like it's for someone who has money and who can, you can just like move to more temperate environments, right? It's going to be in a much better situation than a community and community members that maybe have poverty, or they're kept out of certain neighborhoods because of, say, like racism or other aspects of discrimination, and they may be really exposed to things like flooding or landslides or extreme heat, and this is something that, well, I don't know, maybe that could happen. This is like today, right? This is in the news like right now, like literally every day. And also thinking about like intersectionality typically influences how one experiences a socially engineered trauma. And intersectionality is like all the different aspects of our identities. So I'm in a situation where I have a number of identities that maybe, from different minoritized communities, different discriminated against communities. Typically, kind of the more communities I'm a member of, I may experience even more aspects of some of the socially engineered traumas. And here are some examples, that we certainly see. Very aware 30 years ago when I got to this field as a substance use provider, very aware of like the war on drugs and how it was just, absolutely devastating communities, because, and it still does, because we have so many people caught up in the war as like victims and people considered perpetrators of the drug crimes are victims of this process, end up incarcerated for very long times. I got to be a part of some of the first drug courts that came into play, which was, the idea was not to lock people up, but for people who are nonviolent to actually, come through and have options for treatment, which was, an example of being able to step away from some of that automatic, incarceration. We sort of see this, they say homelessness. We talk about house, not say homelessness is not really the word we necessarily use now, but like houselessness or unhoused, because you can be, without a house, but not feel like you're necessarily homeless. But certainly we see people who live without shelter, who really struggle. And again, the more one might be experiencing different aspects of discrimination, the more likely one might be unsheltered. We see this in terms of domestic violence, intimate partner violence, where those, again, who have experienced the most discrimination might have harder access, finding ways of getting out of really difficult situations, having difficulty being believed around their experience of violence, and getting to a safe place. So this is a lot to hold, right? And just by focusing on the individual in front of us who's experienced all this, it just and lets those benefiting from these systems like off the hook, right? I mean, we're not really questioning again kind of root cause. And that there's a thought here. I'm curious what your thoughts are. Like withholding information on larger structural dynamics could be considered an ethical violation. And I know increasingly, like things that we're teaching more often now in like at least counseling psychology programs I'm familiar with, is we are teaching aspects of social justice. And again, not taking this for granted, right? We know there are definitely movements afoot where some folks really don't want this stuff being taught. Right? I'm just gonna be really frank about that. So that's an issue. It's definitely a political issue, and it's one where there's a lot of tension around. And being able to help people see, not just from their perspective, not just from their thing of like, here I am, I'm having all these problems, what's wrong with me, but to be able to see like in the context of there's real things occurring that end up influencing how you got here. Thinking again, I didn't include the slide here today, but thinking again of the slide I had earlier of on Tuesday, where we had the ACEs, right, where we had the tree coming up from the soil. So like the tree was all the individual adverse experiences, and if you remember, the soil was like the structural experiences, and then of course we also had the climate impacting people's wellness as well. My stuff in italics. Current systems are not broken; they work exactly as they were intended to work, right? So if there's some sense of why is it so hard to fix a system? It's like, well, basically it needs to be, just to kind of speak truth to power for a moment, like those empowered don't give it up easily, right? There's some benefit there. And social injustices are replicated as we move through systems of care, for only part of the system of care. So it's when I kind of think about that, like at different aspects of the system of care, if we're not kind of looking at where we're at and like how people are being impacted, and it's not always easy to do. I mean, I've worked in many kinds of systems over my career, and there's definitely things I kind of figured out like later on. And it's like, oh wait, I helped participate in this. I helped set an arbitrary barrier that kept someone out of services. I helped tell someone they were responsible for something that was really difficult for them to get over. I'm basically part of the problem. And I'm glad I have perspective on this now, but I don't feel great, about things that I've done where I just didn't get it. So I think these are good conversations to have. And we're at a place now where real change is really, we need to have some aspect of grassroots activism. We're seeing this in a number of places, and it definitely does shake up folks who have power, right? So folks who are doing grassroots activism, there's feelings about that. And yeah, I think argue in this paper, and I can't agree more, that there are places where we can really empower the people we work with to to take a step in here. What would be to have a little bit of activism, organizing, even consciousness raising, just kind of, again, awareness, being able to have conversations. So considerations for intervention then. So micro skills within a macro frame is the potential opportunity to help reduce shame and blame that occurs with trauma exposure. And so it's like, how can we think about like incorporating some aspect of social education and psychoeducation into other types of discussions? So think about, as we're explaining, say like a diagnosis to an individual, or maybe there's a group discussion about, certain traumas that people have experienced. I'm thinking even at the diagnostic level, someone might be diagnosed, let's say depression or anxiety, what have you. But if we can have that conversation within like someone's context and think a bit about their life and their experiences, that still is something that needs to be treated. If someone's anxious and they don't want to leave the house, if someone's depressed and they can't get out of bed, these are things that need to be treated. Talk therapies might be medicine, might be a whole number of things, right? There's still all the evidence-based practices still occur. But what if we did have conversations about the impact of and the extent of trauma, right? To be able to have some comments with folks about the conversations with folks around that. And then what if we also have a situation too where we can help people who are struggling in various aspects of recovery to be able to be a part of a community as a component of clinical intervention. So if someone, for instance, and I have this question here, what type of activities might be the most useful for any particular client? That's I think a helpful thing to really think about. So for instance, and I'm curious again, you can put other things in the chat what you're thinking about. If I had, I've certainly experienced this with folks. I have a number of folks, actually, I'm one of them, who has a hard time just like with daily news. Right? I mean, there's a number of people who it's like we're going to go on a news diet, or we're going to go on a Twitter diet for a couple of days because we just become so depressed seeing the stuff that's coming up. It just feels overwhelming and completely distressing. And I've had people just completely spiral. And again, you may experience this yourself. I know I have. And so what do I do with that? When people are feeling just so overwhelmed and, so unable to manage, I mean, to me, I explore values, I explore kind of impacts, what kinds of things that people are concerned about. And that's where I might do like, well, a what if, what kinds of things can think of your illicit, provide illicit, what kinds of things can you think about that might be helpful given your anxiety and your ability to want to do something? Again, it can't totally change the world one person, but one person can be part of a movement. What kinds of things do you have in mind that you could potentially participate in? They don't have ideas. Sometimes I think of things myself. There are things you can consider that sometimes can help be a part of a change. Would this be something you'd be interested in, building a movement, whether that be being on the streets or, collecting signatures or writing letters? There's all kinds of things. Voter drive, I mean, all kinds of ways people can be involved. SHARP. What does SHARP stand for? And these are things we can start thinking about in terms of the content that we can bring to discussion about context in our clinical practice. Helping people think about aspects of structural oppression. So what aspects of a person's physical, social environment that is in or out of our control that impacts their ability to be successful, right? If there's a certain piece, if there's like I'm thinking of like, for example, like aspects of say institutional racism, or places where people don't feel safe because they don't feel like they can be who they are. They don't feel like they can walk down the street with their partner without being attacked, for instance. Kind of thinking about those types of things and just being aware, just bringing it to the conversation. Thinking of historical context, and many of you were talking about that a couple of days ago we talked about this, about generational historical trauma. So communities are traumatized, and they're traumatized over time, and that impacts like how a community responds, and it impacts the kinds of messages that individuals get about where and when and how they can be safe, right? And so how might that be impacting them now? And I'd like to, by the way, just have conversations with people, like defining these things and saying, and so tell me how this shows up for you. That might be my open-ended question. Tell me how this might show up for you, because I don't want to be making an assumption. I want to be, I want to be providing leadership and taking a role as a clinician around, hey, I'm willing to talk about this stuff. I have some basic knowledge about this. And I also know that you're your own individual. So I'm interested in your perspective. Your comment there about the rural structural challenge, aspects of just lack of resource, including transportation. It's absolutely incredibly oppressive and really difficult even for people to get the services, right? I've worked in places and have consulted with places where folks can't see a doctor for like 6 weeks at a time, but also part of that's just because they can't get a ride into town to see the doctor, so it becomes just really difficult. We got that in rural areas, also in rural and urban areas. And so notice what Graham's talking about too, about this idea of food deserts and polluting plants. Yeah. Okay. Yeah. Thank you for bringing that up. analysis of role. And so again, thinking of ourselves, right? What I said before, am I part of the problem, or am I, am I just a maintainer, or am I disruptor of the status quo? Am I an agent of some of the structural oppression? I know some of these words seem really intense, or am I an ally? Am I accomplice to kind of help support somebody? And then, of course, our piece that I love because it brings up again around affirmation and values, which we discussed yesterday, and strengths of changers. Like, what strengths and gifts can a person share in the clinical setting and in their own community? So I'd love to be able to also notice that when you're right now, I'm noticing your ability to do this, your ability to have insight, your ability to help out other people, your perspective to speak the truth, your ability to speak the truth in your unique perspective. Like, that's a great place in the micro kind of individual session to start building that confidence, that self-efficacy through affirmation that maybe then can be brought into the next step of change. And power, what can the person do alone or with others to change the ongoing impact of historical and structural oppression? And I have it in this slide, and I'll continue to say it because I remind myself of it every day. Of like, individually, it's really easy to feel like I'm not sure what I can do, or if I can do much, or I'm just doing this today. I'm just doing, I don't know, maybe I'm signing a couple petitions, or I just read something and got myself more informed. That's all I did, is not very much. And what I like to tell folks is like, yeah, if we think about individually what we're trying to do, it seems and feels impossible. So we have to change our thinking. Thinking of individually, how hard this is, to what am I able to do collectively as part of a movement. So it's not about, individually, I have to change this. It's like, I'm showing up because individually I'm going to change the world. No, I'm showing up individually because I'm building a movement. Right? That's a really different way of framing that, had that happen. I wish this was mine originally, but someone in my family gave that to me, that idea. And I was going to some kind of demonstration a couple of years ago. My friend's like, "You're always dragging me to demonstrations. Like, why are we here? Like, are we really making that much of a difference?" And it's like, not individually, but we're building a movement. And that got this person to keep coming to demonstrations with me. They really kind of got that idea. So I love that. So social justice, activism, community organizing, consciousness raising, policy advocacy, organizing or participating in mass action. These are all really important places where we can start thinking about, where can someone start to exercise their power. So if we're kind of thinking about macro MI, like how is this going? It's actually often called macro plus MI, because we're thinking in the macro sense, and we're kind of pulling in some motivational interviewing. So what we're trying to do then when we sit with anyone is we're really trying to think about their status quo, their problem, the things they want to focus on as we go up our little steps, and we get to focus, kind of thinking here, okay, about any presenting problem someone has. Is it caused and maintained by context-specific factors? Sometimes it might not be, or or might not, or might be kind of tangentially. And if so, okay, or in what ways? Then we can use the sharp idea to help us kind of connect to accurate empathy, right? So I'm kind of really being aware of the fact that this person isn't being difficult, or or really troubled, or what other judgment potentially I could have about what's wrong with them. I'm really thinking about what happened to them. Right? I'm taking that trauma informed approach, and being patient, because it does take a while for disclosure of trauma and people's concerns to take time. It takes a while for that to be built. Again, also thinking of collaboration, right? So the more I can involve someone, again, the spirit of MI, building up trust and reciprocity, and getting people's feedback, and being curious about other people's perspectives about systemic issues is really important, because I might think I have all this analysis about a particular systemic issue and how it impacts the community, but of course, if I'm not part of that community, I'm probably wrong, at least in some way. So really being open to listening. And I like to also collaborate around, what's our structural analysis of this cause of this. Again, what happened to you with this idea to help reduce shame and help people be aware of their own power. And we kind of have to, I think it's important from in this article, we really are the ones to have to lead this conversation a lot of times because there are so many taboos kind of historically about talking about structural issues, political issues in therapy sessions, let's say, or counseling sessions, or casework sessions, right? That's kind of considered, we're not in our lane, and I think that's something to really be thought about as well. Like, wow, how is that true? Like, am I out of my lane when I do this? Like, who benefits from me not having these conversations? Micro skills that you've been learning, and talk about how they might show up in a macro sense, right? Because we've been learning about the OARS, open-ended questions, affirmations, reflections, and summaries, and giving information and advice. I was doing some wellness recovery action planning today with some folks, right? Some of you might be familiar with RAP, and we were looking at things that stress us out, and activate some of our stress reactions. And we had this big conversation about social media. On some levels, like, it's really so compelling because there's things that we like on social media, and some things really help us relax. And there's other things that are almost horrific in terms of how they make us feel about ourselves. I'm just think of social media in particular, although we can look at media more broadly. I think that's a really important conversation to have with people as well, systemically, just because all these things play such a big role in our lives. To think about change happening without thinking about all these other, like, social media kind of influences that show up outside of session, right? And so one of the things we talked about is, how do we start to think about, like, the good versus the not so good social media? Like, there's some social media that I want to make sure is loaded up on my phone and certain people I'm following, and how do I get rid of maybe other folks? Like, to make those kinds of decisions. Like, this helps with my self-care, this does not. So that's a good conversation to have with people. How do you encourage reflection with practitioners when they're off the mark? And I'm not sure what you mean by off the mark there, but maybe if you're thinking that they are not, maybe they're judging folks, they're not seeing, like, structural impacts, those kinds of things. Yes, okay, great. So here is an example of a place where I think, we can only control so much, but this is what I really do encourage, some aspect of reflective circles. Certainly, this is something that could be brought up in things like group supervision, clinical supervision, could be a retreat topic, could be something where if you have, opportunities, again, back to the social media piece, I'm not so sure if this is always a great topic to have, like, in a Slack channel, because there's so many, or email, because there's so many places for misunderstanding. But I do think, again, I don't want to oversimplify how complex this can be and how reactive folks can be around some of this, just because people have their own thoughts about it. But I do think it is helpful to have these conversations. And it's hard. I I had some very difficult conversations the other day with someone who really disagreed with me about some aspect of body autonomy and choice, and they were offended by the fact that I have these feelings about people being able to have choice. And so that was, it was different than me. We have some big different disagreements, and the only way I was I felt pretty good about doing that was at least at the level of, between the two of us, starting to have some of these conversations, and I won't necessarily be able to convince folks, but I do think, from my perspective, and everyone can make their own choice around this, like, that's part of what I bought into. That's part of where my leadership comes, of like being able to advocate for some of these ideas. And it's not always easy. Sometimes it comes a little bit of bruising. So I'm going to get into then different ways that they talk in this article about using macro and macro plus MI. And so this idea of thinking the macro situations and how we're going to bring in some of these micro skills. So information exchange, I gave a little example of that, but elicit, provide, elicit. If I did want to start thinking about structural issues, like, how might this be impacting you? What do you think might be other concerns for your situation? Asking those kinds of questions, bringing up the idea of asking permission, because there might be some folks where it's like they're not there, they're not they're not wanting to talk about this. Maybe they have certain feelings that it's the structural piece is not something I want to explore. Um, even if I think I'm right, like this is totally a structural issue, it gets back to what I think what I was talking about earlier about it's better to be effective than it is to be right. Got that from the DBT community, where it's like ultimately, my value in the spirit of MI, it's like it's around having some choice. So I want to be able to be really aware of that. There's also providing feedback, sometimes just letting folks know, again, with choice, thinking about like how different social movements have changed systems of care. And, we have a number of examples of that. They don't change it, perfectly, but they have made incredible changes. Systems in social movements need to be tended to. Sadly, it's not a kind of thing where you fight for something for 10 years and we can like, okay, walk away, it's all over. Unfortunately, these are things that have to continue to be kind of built, as part of movements. I also remind folks and they advocate reminding folks it's a long game. I've done some systems work in clinical systems of care and had people say, this is great, you're doing all this integrative work. Like, isn't it done yet? It's like, well, it takes, a good at least 3 years to start seeing some change. Sometimes it could take longer, and what we were doing was we were working on different types of welcoming like practices where we had people who may have only been seen in a substance use program start to be able to come over to mental health to get some support, and people in mental health programs be able to go over to substance abuse with like minimal barriers to access. Fair enough, right? That seems like makes good common sense. And, if this is something we are doing like 10, 15 years ago, of course, why wouldn't you? There was a lot to break down in terms of territory of systems and staff and barriers, and it's still up in process. It's still not a perfect process. It's still, for many people, and some of you might experience this, difficult to move from one system to another, one system of care to another. So it's a long game in terms of changing a system. And also, again, as I said before, it's not about individuals being able to go in and change a system. It's about building a movement. There's also open-ended questions, and you get a chance to kind of think of like what might be some open-ended questions you might ask someone about the system. No right or wrong here, we're just kind of thinking this through. But sometimes they can be evocative regarding impact of systemic oppression, and sometimes help folks sort through their own relationship to an issue. Maybe if I had someone who was like, this is just an example here. Like I think I may have gotten these examples from the article. I'm trying to remember here, but if you mentioned not like any treatment programs, how might your experience in recovery be different if you were cisgender, right? So think of someone who might feel really, alienated from a system of care that wasn't serving trans folks. Or maybe a better way to ask this too would be, it seems like these treatments, programs have been not meeting your needs. If they were meeting your needs as someone who identifies as trans, what would be different? It doesn't mean, again, that this person is like that's going to be totally satisfying or solve all their problems just asking that one question, but it kind of helps people think about like, this isn't about them being like bad or flawed. It's about a system not meeting their needs. You mentioned spending years on Section 8 waiting lists. Why do you think there's not enough housing in the community? Like, it's not about you not trying to get into housing. It's not about you, not doing the right things, and being flawed in some way. But what do you think might be the larger issue with housing? It just gives people a chance to talk about this and take some of the pressure off being seeing themselves as like an individual flaw. And focus on change. So at the individual level, we can talk about acknowledging the need for change, being able to prepare maybe the system being changed, and that maybe there's like an individual like change plan, like things I need to do myself, but maybe there also is like a change plan that someone can get involved in terms of mobilizing to help be a part of changing a system, and how like sometimes changing a system really helps people get activated around changing themselves. I mean, any of you have participated in social justice movements, let's say, and it doesn't have to be necessarily like completely like political. It could be something like a community movement, like, building community resources, being part of, various aspects of, building, let's say, like a community center. I've known a lot of people who've been very involved in their faith community and building resources and building connections, like whatever that community comes up with, housing, or let's say more, food options or whatever it might be, like that's a cool thing. But what's really important is actually the process of being part of that change, like feeling like I have a purpose, meeting other people, joining in together, in a in a in a process of change, so it doesn't feel so alone and alienating, and it also gives a role while many people are able to move toward their values. So another thing they mentioned, which I think is really helpful, is like working with ambivalence. So people may not totally be into like looking systemically, or maybe like unsure about this, or maybe like, yeah, I think this is more likely. This is certainly what I've experienced. I can see where there's a systemic thing going on here, but I have no power, again, to do anything about it. Or even if I'm part of a movement, look, there's been movements before, and look what happened. Things are going backwards. Like I could, and I have seen people, and I've heard people say this, including friends as well as clientele. And again, like, we just use reflective listening, use active reflective listening, be curious, affirm their willingness to talk about this, and be evocative, right? So be evocative, I think it gives people a chance to be heard. I think when more people are heard, maybe that, we do start to hear a little bit of some change talk about, like, and we can reflect like, yeah, this is really difficult. And I'm hearing you say, you're really aware there needs to be something around safety in your neighborhood. Like you're just, really aware, like you don't want children growing up feeling this unsafe. We also, this kind of gets maybe to the question about earlier about, other clinicians who might not be, on the same page around this, that, we practice using self-reflection, because we need to write the boat at times. And there's times when we might not see this, we may not, we might be uncertain about if there is a macro issue, or maybe there is one. And any one of us, I'll include myself on this, like, may not be able to see it or want to see it, or I can speak for myself, feel defended around it, like that's not really that big of a deal, or that isn't really the issue. And maybe I need to stop and think, maybe I need to get some other feedback around that. What's an open-ended question? And, which is somewhat, most people know like what open and closed questions are, but in motivational interviewing, we do ask questions. We try to be sparing with them, just in general, because if we ask too many questions, people start to feel over interrogated. We have yes or no versus elaboration. I like that, Tara. That's a really good one word answer versus, like, say, storytelling. Yeah, absolutely. And so basically our closing questions like have short answers, usually yes or no. Did you attend your appointment this week? They ask for specific information. What's your phone number? I always joke and say, I don't find myself asking people, tell me a few things about your phone number, right? Like we want to get really quick on some of these things because it's cut and dried. And sometimes it can be multiple choice. Do you plan to quit, cut down, or keep drinking? Yeah. So those are fine. That makes perfect sense. And it can be very useful. And MI, we like to think in favor more of asking more open questions, because my metaphor here is the open door. They open the door, they encourage people to talk. They do not invite a short answer, and they leave a broad latitude for how to respond. And I love all the ways you all are responding to the question itself of just, thinking of all the depth around an open-ended question potentially. And I'm curious in the box, and just, again, you can always just chat this out too. Is how many of you have asked a question, thinking an open-ended question, oh, they're going to say this. This is kind of where we're going. And you ask that question and someone ends up in an entirely different direction. It's like, I am so glad I asked that, because they said something I wasn't even thinking about. They said something that was like a totally different theme. So open-ended questions can be really helpful in order to clarify like what's important. So we have some guidelines here around questions in general in the MI world, which is generally we want to ask fewer questions, and we're trying not to ask 3 questions in a row. I think that's a helpful guideline. There's no hard and fast rule on that if you ask 3 questions in a row, you're going to be thrown out of the MI club. But it's a guideline. And sometimes, we do ask more, but generally that's a good idea. To limit it to no more than 3. We want to ask, yeah, and some people like that, right? They answer only one words, even when you do a good open question. But generally, we want to do more open than closed questions. And I like to use the idea of sandwiching, which is the idea that ask open a question, and then someone gives me some information, right? That's maybe more robust in terms of an answer than yes or no, and they give me some narrative, and I want to honor that with reflection, right? So the reflection and being able to mirror back their answers, like on some level, saying thank you for that answer. I am seeing you, I am hearing you, and now you know because I'm mirroring it back to you. And I like to do at least a couple of reflections for every question. And we're kind of seeking that. It's best to even do more. Again, we can't really reflect enough, and we have different formats for reflection that give us a lot of opportunity to do that. And that the spacing out of the open-ended questions with these reflections really allows more for that dancing kind of being in flow. Also, just to let you know, if you do something like a was, would, could, can, is, are, have, has, did, or do, it closes up the question. So if I say something like, so David, you have there, tell me more about that, whatever that is, tell me more about your experience in school, right? Then the tell me questions usually are always very open, and people can respond to that. So tell me is a good thing to begin with. But if I say, could you tell me about that? A lot of people will get it, like that's an open-ended question. But if you have someone who might be, maybe a bit more, reluctant, let's say, like a teenager, for instance, you can get a no, I can't, right? Because really, when you put the could in front of it, it does make it closed, right? So just be thinking about that. And again, these are our attempts to open it up. Doesn't mean it's going to be open. Yeah. Or as Patricia says, no, I won't. Yeah, I can't, or I won't. So tell me is a great place, describe for me, some of the process questions. We talked a little bit about these earlier. What kinds of things would need to happen in order for you to want to change? What are some good reasons for stuff? How might you go about doing X, Y, Z? How is your experience different from your family's? That's a really interesting piece too, especially for folks who are, in a situation where, things maybe aren't as easy for current generations as they were for those above them. So these are things, that I'm kind of thinking about. And because of time, I might just kind of have you put this in your parking lot mind. But, if you think about like this process of creating open-ended questions to ask, and is it easy? You don't say easy, but how is it challenging, or what ways do you have to think differently if you're considering like the systemic kind of issues, kind of socially engineered trauma, and like how that comes into a question. How does that work your questions differently, right? So you might just be thinking about that, right, as you do it, because it is challenging. It's a challenging piece to get specific around it and to make it kind of more systemic and global, and to be able to generate that curiosity. How would you do a self-summary? How would you collect? Summaries collect, and they bring together, and maybe they link with other things that you've done. What would you summarize in a couple of sentences, 1 to 2 sentences, what it is that you are going to take back to your work? Look at all of people's great stuff. Took away the importance of using MI in the contemplation preparation phase and other interventions such as CBT in the action phase. I also use a window of tolerance with my families. That's great. What if you're actually literally part of the system of oppression, which I imagine like we all are in some way, right? But if you're working, like say for prison, you're working in the carceral system, I'm going to be really honest with that, is more challenging, right? Just because like who ends up getting incarcerated. But there are things that you can kind of think about in terms of in the system, like, and how people who are there like participate in their lives, and what it means for them. What does basically psychological liberation mean? Like what does freedom mean for them, and like where their values are? I would say start with folks who are in that system to really start working on values, and then to be really curious with them what might be some of their next steps. Obviously, some people who are in for life, that might be a really difficult situation, but I think helping folks find some meaning and thinking about like their next steps, like what does that mean for how they want to participate for their life when they get out. And for some and many people who get out of prison, not everyone, of course, but many people find ways of being involved in their community. I mean, it certainly helps with like not going back. It's protective for them, but I think it also gives them a real chance. Many folks will find out to feel like they're being part of a solution to keep other generations out.
Thank you so much, Kristen. This has been a fabulous presentation. Thank you for being here.